Okay, so I'm going to start in the med room with verified patient MAR. Patient's name is Manny Stickens, and going through 0900 injectables or medications. We're going to start with the Practi Amp. So I have a Practi Amp. I need 1.7 ml. I have a 2 ml ampule, so that's enough for the 1.7 ml. And expiration date is February 2029, so it is not expired. Next is the insulin R. I have insulin R. I need 8 units. It's 100 units per ml, and it is not expired. Expiration is February 2029. Next is insulin N. I have insulin N. I need 12 units. There's 100 units per ml in this vial, and it is not expired with expiration February 2029. Lastly is the Practi Tub. I have Practi Tub. I need 0.1 ml. There is 5 TU per 0.1 ml in this vial, and that's enough for the dose. It is a 1 ml vial. And expiration is February 2029, so it's also not expired. All right, so we're done with our first check. I am just gonna get closer for expiration date, and I'll move to the nurse's station. Okay, so for expiration dates, this is the Practi Amp. It's a little hard to see the expiration, but again, it is February 2029. It is right there. Next is insulin R. So we have our insulin R, and it is not expired, February 2029. Our insulin N, which is also not expired, February 2029. Lastly is the Practi Tub. And expiration is February 2029 as well. Okay, so now I'm at the nurse's station, and I can go ahead and do my second check and get medications drawn up. First medication is the Practi Amp. I have the Practi Amp. I need 1.7 ml. I have a 2 ml ampule, and it is not expired. Now for this, you just want to go ahead and shake, make sure all the medication is in the bottom of the ampule. We are going to need a IM syringe. I have a 3 ml syringe, and this is the appropriate syringe because it is calibrated at 0.1 ml, so it will give us an accurate amount. For the needle, I have a 21 gauge 1-inch needle, and then the filter needle. So I'll just get the filter needle ready before I break my ampule. And since it is an ampule, we do not inject any air in there. Again, I already shook all of the excess that was in the top to the bottom. Just gonna place this on here and go ahead and break away. Drop that in the sharps and that in the trash. And again, 1.7. I am going to get as close as possible to 1.7, but I will overdraw just to make sure. Okay. So we do not want to waste with the filter needle. So I'm just gonna go ahead, cap that back. Place that in the sharps. Just want to get all the air bubbles to the top of the syringe. And go ahead and waste over a trash can. Okay. And then we will go ahead and label our Practi Amp syringe using the triangle method. So we have Practi Amp. And expiration. Okay. So just want to double check 1.7. We have 1.7 in there. So double check. Yes, 1.7. Practi Amp, and expiration is good. So here is that label. Just gonna go ahead and label the syringe. And now I can go ahead and discard this in the sharps. Next medication is our insulin R and our insulin N. These will go inside a insulin syringe. I have a 50 unit syringe here. It's a 29 gauge and 1/2 inch. So for our second check, I have insulin R, 100 units per ml, and I need 8 units, and expiration February 2029, so not expired. Second for insulin N, 100 units per ml, and I need 12 units of that, and it is not expired. Okay. So I'm just gonna go ahead and get my insulin ready here. So before, you do want to just roll the insulin in to make sure that all the medication is mixed thoroughly. And then go ahead and then together, the 12 units of insulin in and the 8 units of insulin R equals 20 units. So I'll draw up 20 units of air. And I'll start with my cloudy, which is insulin in, and inject 12 units into there. Okay, now I have my insulin R. I will inject the rest, which is 8 units, into there. I will draw up 8 units of the insulin R and finish drawing up the 12 units of the insulin N, which will go to 20. Okay, so now I need to label the syringe. We'll start with insulin R. So insulin regular, And it's 100 units per 1 ml. Expiration is 2029. Okay, so just double checking. Insulin R, and that's 20 units and 8 units of that. Next is insulin N or insulin NPH, which is also 100 units per 1 ml with an expiration of 2029. And again, for insulin regular, we had 8 units and then 12 units. Total. Okay. And here's my label with all of that information, the 100 units per 1 ml for both of the insulins, the expiration date, the units, and 20 units total. Lastly is our PractiTub. So I have PractiTub. I need 0.1 ml. I have a 5 TU per 0.1 ml vial, and it is not expired. And this is just the one dose that we're giving now. I need an intradermal syringe, which this one will do. It's 27 gauge and 1/2 inch in length. Go ahead and put some alcohol. 0.1 of air inside the syringe. Inject it inside the vial. And go ahead and draw 0.1. Okay. Okay, lastly is to label our PractiTub. Five TU per 0.1 ml and expiration to 2029. PractiTub, 0.1 ml and expiration. Okay. Now that I have all my medications, I can go to patient's room and do the third and final check. I will put all medication or injectables back in the Pyxes according to facility policy and clean up the med room or the nurse's station according to facility policy. Okay, so I am now in the patient's room for my third check. Hi, my name is Monique. I'm a student nurse. How are you doing today? Patient states they are good. And if I could just verify your name and date of birth. Looking at MAR, patient says Manny Stickens. Matches wristband, Manny Stickens. Date of birth, 12/15/XX. Date of birth, 12/15/XX, or 48 on here. Do you have any allergies, Mr. Stickens? And he states that he's allergic to penicillin, which I have here. All right, so we are going to go ahead and be giving you your injections today. Since these are not real injections, I do not have to give any patient education. Okay, so now we'll do our third check. So we have the first one is the PractiAmp. I have the PractiAmp 1.7 ml, 1.7 ml, and not expired. So 1.7, not expired. And insulin R, 8 units. I have insulin R, 8 units, and it's not expired. I have insulin NPH, 12 units, and it is not expired. Total of 20 units. Next, I have the PractiTub, 0.1 ml, and it is not expired. So 0.1 ml. Okay, so now I can go ahead after third check and give patient medications. He does not care in what order, so we will start with the PractiAmp. This is a Z-track method, so I'll go on the ventrogluteal since it's more than 1 ml. Just gonna clean, let it dry. Okay, so I'm just gonna pull the skin away from the injection site, go at a 90-degree angle, aspirate. There is no blood present, so I can go ahead and inject the medication. I can go ahead and pull the needle and let the skin retract, put on the safety, and go ahead and put that in the sharps. Put a little bit of pressure, but we don't want to rub or massage. For this injection, you might get a little bit of muscle soreness since it does go inside your muscle. All right, so the next injection is going to be the insulin in the patient's abdomen, and we are 2 inches away from the umbilicus. Okay, it dried. I can pinch more than an inch for the patient, so I can go at a 90-degree angle. I go in, I insert, I release, and then I let the medication go in. Then I take out, go ahead and ignite safety, put it in the sharps, and go ahead and put some just a little pressure, but again, we don't want to massage this injection either. Lastly is going to be an intradermal, and this is going to be on the right ventral surface of the forearm. And I didn't mention the other two, but it was the right lower abdomen and the right ventrogluteal. So that did go ahead and dry. This is going to be at a 5 to 15-degree angle. The bevel is up. We just want to make sure that we go just underneath that first layer skin, about an eighth of an inch way in, inject the medication. I do see a bleb or a wheal present, and then I ignite the safety, and it's in the sharps. Again, that one is going to be needed to be read within 48 to 72 hours. And just a little pressure, but don't rub. Okay, so we gave the injections, and I can go ahead and document. So PractiAmp was given, again, in the right ventrogluteal. Both insulins were given in the right lower abdomen. And lastly, at 0900, we gave the 1 dose of the PractiTub in the right arm or the right ventral surface of the forearm. I'm gonna go ahead and sign my initials here with SNSCC next to it and my initials. Okay, so I am done with patient. I made sure that the bed is down in the right position. The bed is locked. I asked patient if he needed anything else. He states he's okay. He does have his call light, and I let him know I'll be back in an hour to check on him.